In this video, we are going to do a basic overview of muscular anatomy. So let's get started. With this video, I'd like to once again preface our discussion by saying that this is not going to be a detailed walkthrough of the muscles in the human body. I will just be covering the absolute essentials that artists should know as a fundamental precursor. As always, I encourage you to do further research by watching content from experts who are much more knowledgeable on the subject. This video is just to get you in the headspace to maintain the structural integrity of the characters you draw. So before we get started, let's talk about some concepts and terminology that you might hear about when you're talking about muscular anatomy. Muscles tend to attach to bone as tendon before transitioning into muscle tissue, which increases in thickness until what is often called the belly of the muscle before decreasing back into tendon. Many muscles are often in multiple parts, attaching to a variety of points to allow for function, and we'll use Latin prefixes to denote the number of parts or heads. Examples of this include biceps and triceps, which denote two-headed and three-headed muscles, respectively. So with all that aside, let's get started. For the sake of simplicity, I'm going to be skipping over the head muscles and starting straight with the neck. The most important and most visible muscle that we'll talk about in the neck is the sternocleidomastoid. This muscle derives its name from the various origin points it connects to, including the sternum, the clavicle, and the mastoid part of the temporal bone on the skull. From there, we have the infrahyoid muscles, which is a group that helps with swallowing and the movement in the larynx. There are four muscles in this group, including the sternohyoid, the omohyoid, the thyrohyoid, and the sternothyroid. Typically, you'll see these muscles when someone is talking or straining their neck, but this is about as detailed as we're gonna get. Next, we have the scalene group, which are a group of muscles that find themselves in the space between the sternocleidomastoid and the trapezius. Their individual names are derived from their positions within the group, so the anterior, middle, and posterior scalene muscles. Finally, we have the trapezius. Most of the mass of the trapezius muscle is on the back, but you can see it from the front in most bodies, and especially on bodies that have increased muscle mass. The trapezius is a really important muscle when it comes to posture and movement. For example, its attachments in the neck allow the head to tilt and turn, while also aiding the shoulders in having a full range of movement. So now that we've talked about the neck, let's talk about the torso. There are four major muscles that we're going to be talking about, namely the pectoralis major, the serratus anterior, the external oblique, and the rectus abdominis. The pectoralis major originates from a couple of different spots, including the clavicle, the manubrium, and the sternum. The muscle itself will then insert into the humerus bone underneath the deltoid. This attachment allows the pectorals to aid in a multitude of arm movements, including internal rotation, flexing, and adduction, which brings the arms closer to the center of the body. Next, we have the external obliques. These muscles make up the majority of your sides, and they insert at the iliac crest in the pelvis. If you've ever heard of love handles, those pockets of fat sit right above the insertion point of the obliques. The external obliques share responsibility with its internal counterparts in aiding the movement of the torso. Together, they allow the torso to rotate and bend side to side. Next, we have the serratus anterior. These are the muscles that crawl from the back towards the front by interlocking with the external oblique. They're often mistaken for ribs, however, what they do is they aid in pulling the scapula and therefore the shoulder and arms forward. Lastly, we have the rectus abdominis. Commonly known as abs, this collection of muscles helps you flex your trunk and pull your sternum towards the pelvis when contracting. Now that we're done with the torso, let's talk about the arms. Let me preface this by saying that the arms have a lot of muscles in them. Just the lower forearm has over 20, and I'm not going to cover all of them. So let's talk about the most important ones. First up is the deltoid, which makes up the majority of your shoulder. The primary function of the deltoid is to abduct or pull the arm away from the body. The deltoid itself has three separate heads and derives its name from the shape of a delta. Individually, these heads are called the anterior, lateral, and posterior deltoids. It's important to note that these muscles, much like the other muscles in the body, are not the same shape and size, and in fact their bellies are found at different heights. Depending on the angle and perspective of the viewer, the silhouette and angles of the muscle will change, so keep the high points of the muscle mass in mind. From there we have the bicep, which helps with the flexing of the elbow and rotating the hand into supination, which is a position where the palm faces upward like you're holding soup. The triceps on the back of the arm work in opposition to the bicep. It has 3 separate heads, the lateral, medial, and long head, which all help in the extension of the arm during supination and pronation, where the hand is face down like you're pouring the soup out. The next 2 muscles both help with flexing at the elbow, but they're found in different places. The brachialis finds itself between the bicep and tricep, while the brachioradialis connects to the upper arm and sits primarily on the forearm. Sitting next to the brachioradialis is the extensor carpi radialis longus. While it plays a role in flexing the elbow, its primary function is to facilitate hand and wrist movement, such as pulling the hand backwards towards the elbow. Next, we have the flexor group, which spans from the lateral side of the elbow towards the front of the wrist. Like the name suggests, these muscles allow the arm to flex, such as when the hand closes into a fist. Likewise, we have the extensor group, which spans from the medial side of the elbow towards the back of the wrist. This group works in opposition to the flexor group by allowing the fingers to extend and straighten. Now that we're done talking about the arms, let's move on to the legs. We will start our overview with the quadriceps before moving on to some of the other muscles in the upper thigh. We have the rectus femoris, the vastus lateralis, the vastus medialis, the sartorius, and the adductor group. The primary function of the rectus femoris is to raise and straighten the knee, but it can also act as a flexor for the hip and the thigh. On either side of the rectus femoris is the vastus lateralis and the vastus medialis. As their name suggests, these 2 muscles are found on the lateral and medial sides of the leg, which allow them to perform different ranges in movement. The vastus lateralis helps extend the lower leg, which allows it to strengthen the legs when doing a certain range of movement, such as rising from the squatting position. The vastus medialis helps extend the knee while also locking the patella into place. These 3 muscles, including the vastus intermedius, which is hidden by the rectus femoris, make up the quadricep group. On top of the quadriceps lies the sartorius. It originates on the anterior superior iliac spine and allows the hip to flex as well as rotate the leg away from the body. Along with the sartorius, the tensor fasciae latae and the iliotibial band also help abduct the leg away from the body. The tensor fasciae latae is a part of the abductor group with the gluteus medius and transitions into the iliotibial band. Commonly referred to as the IT band, its name is derived from its origin and insertion points in the iliac crest and the tibia. The IT band helps support a multitude of movements such as flexing, extending, abducting the leg, as well as rotating the hip. On the other hand, the adductor group help bring the leg closer to the center of the body. It's a group of muscles found on the inner thigh and includes the pectineus, the adductor brevis, the adductor longus, the adductor magnus, and the gracilis. Moving past the knee, we get to the muscles in the lower leg. Let's start with the tibialis anterior and the tibial extensor group. These muscles will allow you to flex your toes backwards towards your knee in a dorsiflexed position. In opposition, the gastrocnemius and the soleus muscles allow you to flex your toes forward in a downward pointed position or in a plantar flexed position. Lastly, the fibularis longus allows the ankle to flex and bend outward, which completes the range of movement in the foot. So with that, we've covered a lot of the muscles in the front of the body. Now let's take a trip back up to the top, this time focusing on muscles that can't be seen from the front. In most cases, the sternocleidomastoid and the trapezius are still very visible from the posterior angle of the body. In this view, however, the upper torso has a lot of new muscles focused primarily on the rotation of the arm, shoulder joint, and scapula. It is important to note that there are still a lot of really important muscles that just aren't normally seen. We'll be talking about 4 muscles in particular which are superficial or very close to the surface of the skin. the infraspinatus, the teres major, teres minor, and the latissimus dorsi. The infraspinatus and the teres minor muscle are both part of the rotator cuff group. These two muscles help stabilize the shoulder as well as facilitate the external rotation of the humerus. The teres major, on the other hand, despite its name and sitting next to the rotator cuff group, does not share the same functions as the infraspinatus and the teres minor. The teres major's primary role is actually to adduct the arm by bringing it closer to the midline of the body. Beneath these three muscles is the latissimus dorsi, which is the widest muscle in the human body. It aids in a multitude of movements, including the rotation, adduction, and extension of the arm, as well as facilitating motion in the shoulder joint. It connects to the humerus between the pectoralis major and the teres major, giving it its name, the lady between the majors. This is the muscle you will see utilized and developed the most by athletes such as climbers and swimmers. So those are the muscles and the posterior view of the torso. Now, let's talk about the legs. The gluteus maximus is probably the muscle most people are familiar with. It facilitates a range of movements with the hip, such as extension and external rotation. It originates from a multitude of points, including the sacrum and coccyx, as well as the ilium. It partially inserts itself into the iliotibial band as well as the femur, making it a lot longer than a lot of people might think. Slightly covered by the gluteus maximus is the gluteus medius. This muscle helps the thigh rotate away from the center of the body. This muscle is significantly smaller, originating from the ilium and inserting into the great trochanter of the femur. Below the gluteus muscles is the bicep femoris, semitendinosus, and semimembranosus. These three muscles are what makes up the hamstring group in the upper thigh. First off, we have the bicep femoris, which can be found on the medial side of the thigh. Like its name denotes, it has two heads which work to flex and laterally rotate the knee and hip. The heads of the bicep femoris originate in two places, the ischium and the femur, until they both insert at the head of the fibula. The semitendinosus and the semimembranosus make up 2/3 of the hamstring group. These two muscles work together to help straighten the hip and flex the knee, both of them specializing in the medial or internal rotation of the leg. Moving on to the lower leg, we have the gastrocnemius, soleus, and Achilles tendon. As we mentioned before, the gastrocnemius and the soleus are the primary muscles which allow you to point your feet forward in a plantar flexed position. It is the Achilles tendon which pulls the calf muscles and anchors them to the calcaneus bone or the heel of the foot, maintaining the tension necessary for flexing and extension in the lower leg. So today we looked at the muscular anatomy, which creates much of the silhouette and 3D form of the human body. Again, this may be a review for you, so feel free to skip the assignment if it's not going to be useful. Take your time with the names and the content in this video and move on whenever you feel like you're ready. For your mission, I want you to find a full body photo reference of a person, then draw and label the muscles we've mentioned today. I encourage you to do additional research in order to accurately practice the proportion, form, and arrangement of the muscles. Try drawing bodies in unorthodox perspectives and poses to really test your understanding. We'll be tackling body variety and the basics of posing in the next video, so I'll see you there!